Truncus arteriosus is a unique cyanotic congenital heart disease in which a single great vessel arises from the heart and it is a single semilunar valve. And this great vessel, which is known as Truncus arteriosus, gives rise to the aorta, pulmonary artery and the coronary arteries. So all the three groups of vessels which arise from the heart are branches of a single artery, that is Truncus arteriosus. Naturally, it is a cyanotic congenital heart disease. Collet and Edwards' classification of Truncus arteriosus is a morphological classification based on the origin of the pulmonary arteries. In type 1, there is a common pulmonary trunk which arises from the aorta and it divides into two. That is type 1, Collet and Edwards type 1. In type 2, both pulmonary arteries arise from the aorta still, but side by side from the aorta. That is type 2. When it comes to type 3, they still arise from the aorta, ascending aorta, but on either side. They are not adjacent to each other. That is Collet and Edwards type 3 Truncus arteriosus. And type 4 is two pulmonary arteries arising from the descending aorta. This is sometimes equivalent to the pulmonary atresia, also known as pseudotruncus, with major aortopulmonary collaterals arising from the descending aorta. So sometimes type 4 is not used because it is equivalent to pulmonary atresia with major aortopulmonary collaterals. There are other types of classifications as well. Another situation is hemitruncus, in which one pulmonary artery arises from the aorta. If the origins of the pulmonary arteries are not stenotic, the babies with Truncus arteriosus develop heart failure due to the large pulmonary blood flow, and pulmonary obstructive vascular disease develops early. Truncal wall regurgitation is a common association with Truncus arteriosus, and so is a ventricular septal defect. Dijart syndrome is another association of Truncus arteriosus. The origins of the pulmonary arteries from the truncus may be stenotic and thereby restricting the pulmonary blood flow. Sometimes one pulmonary artery may be absent. Right aortic arch is more common with Truncus arteriosus. Absent pulmonary artery is on the same side as the arch in truncus, while it is on the opposite side in tetralogy of Fallot.